Everyone, welcome. Today we are going to discuss how to manage a case of asthma uh, in Plab 2. A case of asthma will present with shortness of breath. Person may say, I'm unable to breathe, I'm short of breath, please help me, anything like this. We will just discuss about the basic management regarding the asthma, and we are not going through the each and every step of the Simman station. But if you want to watch or see how to approach a Simman station, you can see my previous video on it. Just to save time, just go ahead. Okay. In this case, when you look at your monitor, what will you notice? You will notice that the oxygen saturation is low. Okay, as you can see here, in this case, the oxygen saturation is just 88. So what will you do? You will ask the patient, do you smoke or do you have COPD? And in case its patient says no, then what will you do? You will take out non-breathable mask and you will give oxygen while it 100% 15 liters per minute. Okay, if you're not familiar with how non-breathing mask looks like, you can see in my previous video. And after that, you will take a very focused history, how it developed, had or take any kind of medications, any inhalers, everything regarding this. Just take a very focused history, and if you're unsure about how to take it, you can see in my previous video. I'm just trying to make this video quite short. We are just focusing on the management part. Okay, so afterwards, when you do the chest examination, you will notice some wheeze. So when you heard the wheeze, what will you do? You will take out salbutamol and you will give 5 mg and you will change the mask, non-breathing mask to nebulized mask. You will change it and you will give salbutamol, why it, and it is driven by oxygen. Okay. Okay. So afterwards, when you give it, the oxygen will show improvement. First the oxygen was 88 and now you can see it goes up to 91. So that shows the medication is working. So next step. So what investigation will you order at this stage? These include two investigation, chest X-ray and ABGs to see how the blood gases are working. So when you go to the circulation part, you will pass IV line, the routine blood test, and all the basic protocol which you have to follow. And in this circulation part, which thing you will give? You will give patient 100 mg hydrocortisone IV. Okay. So in circulation part, you will give this. Okay. So after circulation, when you come to the disability part, you will review the patient. And if the oxygen is still low and it's not improving, what can you do? You can repeat salbutamol 5 mg with or without ipotropium. But according to the guidelines, NICE guidelines, it says you can give salbutamol after 20 minutes. So if you're giving salbutamol, you have to mention that I assume that 20 minutes have passed. That's how you are giving salbutamol. So after that, you can do the S bar, which is a handover protocol to the consultant or the senior team. When they come, you will say that what are your recommendation, so that admit the patient, and you will tell about your findings. And regarding MgSO4, it's better not to give the MgSO4 by yourself. You can mention in your S part that I would like that we can give this patient MgSO4 after discussing with my senior. So if you want to know about the dose, it's 2 gram IV over 20 minutes. So, okay. So what are the main points? Let's just summarize in 1 minute. Patient presented with asthma with low oxygen saturation. You give patient oxygen via non-breathing and mask. Okay. And afterwards, what will you do? If you notice wheeze on auscultation, you will give salbutamol. And after giving salbutamol, what will you give in circulation pass is hydrocortisone. And on disability part, when you review the patient, you see that oxygen is still low, not improving. What can you do? You can repeat salbutamol with or without ipratropium. But first try to give salbutamol alone according to the guideline, but you can only give if 20 minutes have passed. So you can just say, I assume that if 20 minutes have passed and the patient is not improving, I would like to give another dose of salbutamol. And according to the guidelines, after repeating salbutamol, then you can give salbutamol with ipratropium. But that scenario will not come because Simman station is of quite less time. It's a 8-minute time, and you will not have 20 minutes time. And regarding the MgSO4, it is preferably given after senior review, because at your level, it's not advisable by yourself to give the patient MgSO4. So that's the very simple management of asthma. Just familiarize yourself with the management and how things look like. That's it. So I'm just going to end this our session today. So in case you guys have any question, you can write down in the chat box, or you can message me in the group, or you can inbox me anytime. And we will soon arrange some cement stations